Health Innovation Global Forum 2024, Milan Auditorium Human Technopole, Mind, Milano Innovation District, a day to talk about the future of healthcare and its innovation and why it is so important for the future of our society. In this moment, we are together with Rifat Atun, who is professor in Global Health System at Harvard University. Thank you for being with us.
Good morning.
Good morning, and today with you we want to talk about the concept of high value-based healthcare. What does it mean and why it is so important to create an evolution of the healthcare ecosystem, we can say?
Yes. Well, health is very important for all citizens of any country and for all of us globally. And there's a lot of investment in health systems. So we need to ensure that these investments create value for citizens. And what do we mean by that? A high value health system will ensure that the system produces interventions or services that are effective, that are delivered efficiently, that are provided equitably so everyone benefits, but in a way that is responsive to the changing context, but also expectations of citizens. So health systems are there as a means to produce outputs for citizens that improve their health, provide financial protection, and ensure that they're satisfied.
So under this point of view, according to you, what are the most important challenges and opportunities coming from this process of revolution or re-evolution of the healthcare system?
Well, I think challenges are there to be solved. So I always see challenges as opportunities. I think the major challenge in the context of Italy or the European Union is the rapid aging. The population is aging rapidly, and that brings a change in the epidemiology with rising chronic illness, increasing disability, increasing collection of what we call multimorbidity, more than one condition together. But the health systems are not designed, or we're not designed to cope with this, because the population has never been this old, and we've never had this kind of epidemiological profile. So one of the consequences that there's a disconnect between the way the systems are designed and the needs or the demand on health system. So opportunities to transform health systems, to face the reality, and to make sure that it's fit for purpose for the future. That's going to require changing the way the systems are, the services are delivered, application of technology, and use of innovations in diagnostics, in new health technologies, medicines, vaccines, as well as exciting developments such as artificial intelligence and machine learning.
Under this point of view, what could be the main priority to tackle from the institutions, entities, associations, and also universities in order to go in this direction?
These are societal challenges. It's not a challenge just for a university or a public health system or the private sector. Society as a whole need to address these challenges and create opportunities. That requires everyone to come together. Universities, to the research, industry, private sector, to develop and ensure that the research is translated into products and services. We also need the health system to ensure that these innovations are taken up and actually provided to citizens. But that's not enough. One has to ensure that there is appropriate regulatory environment to accelerate the adoption of these innovations. We need to ensure that there is venture capital to invest in health systems. We need to ensure that we have entrepreneurs that's going to innovate and take these innovations to market. We also need citizen engagement, because ultimately health systems are for citizens, so their engagement is critically important.
And looking forward, finally, you mentioned it before, the AI, artificial intelligence, and the impact that these emerging technologies is having during this period. Looking forward, what could be the next trend that you can see in order to continue this path of innovation?
I think AI offers opportunities in a number of directions. first and foremost is our ability to analyze very rapidly very large amounts of data that we have in health systems to better understand the root causes of the problems that need to be solved in order to develop highly targeted policies or interventions. So AI makes that possible, and application of solutions in a rapid manner. Second challenge in health systems is shortage of human resources.
And the skills maybe of these.
Absolutely, and the skill sets. In fact, I was going to come to that as a third issue. So AI could replace many of the common tasks that individuals perform in order to release the human resources to focus on things that they ought to be doing. For example, providing care to patients or to citizens. And the third is most health workers spend 25 to 30% of their time in administrative work. AI could replace that. Again, to replace the provide new skills at low cost.
This we hope that this could be possible also in short timings, because we are in a rush in this moment also to try to keep working with the innovation of technology. So thank you for your highlights today and for being with us.
Thank you for this opportunity.